So would you go over those in a list again, the top 5 healthcare costs?
So when we did our research, number 1 is imaging. So that we did x-rays for free in our clinic. So not all clinics can do that, but x-rays, CT scans, PET scans, especially MRIs, I think are the most common. And then number 2 would be orthopedic surgeries. So joints, but any kind of orthopedic surgery would be the number 2 cost. Those are huge money makers. And if you don't interrupt it, when the person goes into the system, one, they're going to pay more, and then typically self-insured is my game, right? The company or the insurance company is going to pay more. Number 3 is oncology or cancer care, all sorts of things there. And then there's also what we call complex case management. There are companies to help manage that. So you want to have those partners, and diabetes or whatever it may be, and dig into those. Number 4 is cardiology. If it's emergent, pretty tough to interrupt, pretty tough to give options. When I say interrupt, I really mean give choices to employees or members. Give choices and give maybe those costs vary. If the company pays more, everybody pays more than the member. If the company's saving, right, and then evaluate quality and make sure it's good. So if it's emergent, that's kind of like the primary care. Well, they get in the funnel and then they could get into a really bad situation. Emergency care is a form of that. But if it's non-emergent, many surgery centers around the country, SCO does all types of surgery. They do surgeries that many don't do, like spine, brain, heart, etc. So and look at their prices, I think you'll be amazed. We talked about the referral, right? So in our case, in central Wisconsin, take a hip replacement. We've had hip replacements as much as $80,000 to have in the system, and we could send them to an independent, say over in Green Bay, and that surgery is around 25. Or we could even send and this is all their choice, again, no forcing, but they could go to Oklahoma, and I think you look it up, it's like $15,995 or something like that. Same surgeries. So even if you look at different systems, you see many variations in price, huge variations in price for the same exact surgery. It's always win-wins. It's not looking for win-loses. If anybody loses, it's the ones that are abusing the system and collecting too much money. But everybody, the member, the person getting care, and the person paying for care gets what they're supposed to. They shopped well and they got good care.
So basically, the way you save $5 million in 4 years is through all these top 5 things, basically, along with direct primary care. Is that correct?
Yeah, I mean, that's been and then some complex case management where if but usually that falls into maybe oncology or cardio, and you're working with that person and say, we have a great option here and we have a great option here. Or can we, pharmacy was one. Our pharmacy curve was looking really badly. So one of the first steps that I would recommend, and I learned this at Toyota and their methods, but measure where you are. And oftentimes, brokers will have trouble with this. People get embarrassed. Like, nobody wants to give you a graph that's really ugly to say, like, your costs have went up for like 9% right, or worse, or 100%. I had one company call me and say, our costs went up 100% last year, Matt. Can you help? And this is just a neighboring company, right? And I'm like, yeah, I'll help you. But sometimes brokers or others, they don't want to show you that graph. Nobody's measuring, first of all. Like, why aren't we measuring our second or third highest cost, first of all? We save a nickel on pens, but we won't measure 5 million in spend or 50 million in spend. Right. But that's one of the first things you want to do. And I would say measure year to year. Here's another trick, because you'll get a graph and it says January, February, March, April, May, and then it's just bouncing around. And you say, what does that tell me? Like, I don't know. Not a whole lot. It tells me what I'm spending per month, but it doesn't tell me if I've gotten worse or better over the last 5 years. That's what I really want to know. And so somehow you have to make it safe, because chances are, if you haven't done initiatives yet, let me use the word yet, in healthcare, your graph probably isn't going to be pretty, but that's okay. See, the Toyota method, right? When you discover a problem, that's good news, because you can solve it, you can work on it. Don't hide it. Don't hide it under the covers. But you have to look. You have to see where you are and make it safe for your broker, and make it safe for everybody that works within the healthcare in your company or whatever it may be, and say, you know what, it's okay. We just need to know how we're doing. We don't suspect it's great, but you know what? The good news is we're going to start working on it. So measure, I would suggest year to year. I would suggest 5 years back, measuring things like total claims, measuring things like total pharmacy spend. Specialty drugs have exploded. Yeah. Measure fixed cost. And interestingly, when you start doing some initiatives in healthcare, often your fixed costs go up, and that's okay. You got to manage them, but that's with the understanding that you're going to lower the variable costs. You're going to lower claims. You're going to lower pharmacy. And if it's all visible, you can manage it. But often we don't even know where we are. What's your annual spend? A lot of times the CFO will know that. What's your annual spend? But that graph, like our pharmacy curve, it was going, same with our healthcare curve, up, 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 up. Okay, fun challenge. What can we do to turn that around? Because HR people, I don't know if there's human resources professionals on this or employees alike. Employees, talk to them and help them, and we can give my email at the end. I mean, I'm one person, but I'm always glad to help. We run a best practice group locally, but you got to try. You know what you're getting when you don't try. And I always said, first thing I say to groups when I get in front of them, all right, we're going to talk about our enrollment, and good news, the premiums aren't going up. I'll get that off, right? So that's the big question on your mind. But I will tell them, you know what? I don't want to get in front of you and tell you that your costs went up 10, 20, 50, who knows what it is, right? Because that's just the way it is. And again, can't control everything, but that's just the way it is. And it's, there goes your raise. I don't want to do that. I'm going to work hard throughout the year to try to prevent that. I promise you I'll try. I can't promise you I'll be successful, but I promise you I'll try. And they appreciate that. And where they know their family members and their friends are getting in those same meetings and hearing really bad news. So that was one thing I always promoted. And then I talked about shopping a lot, right? Here's how we're going to do this. It seems like a no-brainer, but how many years did I sign? Now I've been mostly self-insured, but how many years did I listen to a broker who probably had good intent, or each his own or her own, but employers, by the way. So because I about 5-6 years ago, I knew very little about healthcare, right? So that's one of the things, is educate yourself. I read The Price We Pay. That woke me up, and then look out from there. So if you haven't read that book by Marty, I believe his name's Macri, pronounced, I'm not sure, but Marty Macri, read that book, and that'll shake your tree a little bit. But just kind of recognizing the things in healthcare and what's happening is one of the first steps.